heart, some people use the term cardiomegaly, and some people have used cardiomyopathy. An enlarged heart can be caused by multiple reasons. One, genetics, and that's actually predominant in the African American population. It's called idiopathic is the medical term. Idiopathic cardiomyopathy is common in the African American population. You see it in young patients, or especially athletes who go to bed and don't wake up. That's called idiopathic cardiomyopathy. You see it also in patients who have blockages in the blood vessels of the heart, coronary artery disease, and they sit on it for a while, and so the lack of oxygen to the heart causes the heart muscle to stretch and expand, and that causes an enlarged heart. Drinkers, heavy drinkers, can develop an enlarged heart. People who have problems with the valves that basically control, they're like the gatekeepers of blood flow within the heart. If you have any problems with the valves in the heart, it can cause an enlarged heart. And also people who have thyroid disease. So that's why every woman after the age of 25 should have their thyroid checked at least once. If you have not had one done, please go get one done. People who are anemic, low blood counts, meaning your oxygen is not carried very well in the circulation. And then you have people who've had exposure to drugs that can cause that. So back in the day, the drug was fen-phen. People who've had cancer, who've had chemotherapy, radiation therapy. Anyone who's had chemo should have their ultrasound of their heart done to make sure that they don't have an enlarged heart. So in a nutshell, those are the main causes of an enlarged heart.
What can fertility drug treatment affect your heart?
That's a great question. There is a part of cardiology that deals specifically with fertility management. Fertility drugs can cause high blood pressure and make you a pre-diabetic. And so in those patients, we're aggressive with their blood pressure management and their diabetes treatment. However, the correlation between fertility treatment and heart disease is actually seen in patients who failed fertility treatment. So they've done studies where they've looked at patients who were successful with fertility treatment and who failed, and there's high rate of heart disease in those that failed fertility treatment. And I think it's just because of the exposure of the fertility treatment and the duration has been linked to them having the longer longer episodes of high blood pressure, and also their diabetes might go unnoticed for a while, and by the time they catch up to it, they develop problems. But the incidence for this is not as high as it was before, because we have done a better job not only coming up with better fertility treatments, but as cardiologists, better drugs to treat high blood pressure and diabetes.
What is a heart murmur?
Heart murmur, right. So there are five major valves in the heart. And valves are basically channels that open and close and allow blood flow to go through the chambers of the heart. There are four major chambers to the heart, two in the top and two in the bottom. Whenever there is a leakage in the valve, meaning that the blood should go from the top to the bottom, but some of that blood is going back to the top after that valve closes, the severity of that backflow is called a murmur. Everyone in this building has a leaky valve. A lot of people don't know that. The question becomes, how severe is the leaky valve? And God is the smartest person on the planet. And the reason why I say that is because you brush your teeth every day, right? Those are germs. You brush your teeth, and then when you brush your teeth, some of those germs are going to your heart. So what happens? How does that not cause an infection within the heart? Because of your leaky valves.
Well, God do it.
Back and flushes it out. There's only one person who came up with that ingenious plan. So as we age, those valves become more leaky, and there are different grades we use in cardiology. It's either what we call trace, mild, moderate, or severe. When it becomes moderate to severe, we start hearing a murmur. There are people who have, especially pregnant women, who are anemic. They do have murmurs during the pregnancy. There are patients who have low iron levels, who have low thyroid levels, who can develop murmurs. So basically, a murmur is interruption in the gatekeeping of the heart in terms of the valves, and that's something that's either heard by your primary care doctor or your physician when they auscultate and listen to your heart during an exam.
You kind of touched on this, but how serious is the heart murmur, and how does it affect your health? And if it does, what treatments are necessary?
Yeah, so when your primary care doctor or cardiologist hears a heart murmur, the first thing they need to do is to get an ultrasound of your heart. That tells you how well the chambers are and how well that blood flow is going through those chambers. Manifestations of a leaky valve, if it's moderate to severe, people get short of breath. People can get swelling in their lower extremities. Some people can pass out. Some people can have irregular heart rhythms. So that is all dependent on the severity of the valve. So that's why everyone who has had a history of a heart murmur, or any kid that they've been informed has had a heart murmur, the first thing I recommend is get an ultrasound of the heart. It's called an echocardiogram. They put gel on the heart, they scan the heart, it tells you what the chambers look like, how strong the heart muscle is, and if there's anything that needs to be done. There are different modalities now in our field that can be used to treat the murmur. But majority of murmurs are benign. We do not treat them. We just watch it.
Okay, well, what causes fluid buildup, and is that a sign of heart trouble?
Yes, sir. Fluid buildup. Well, the number one cause of fluid buildup is, who can guess what that is? Sodium salt, yeah. Where salt goes, water goes, right? So yeah, salt. So who are those that get fluid buildup? The way I answer this is actually, I've been fascinated for the last 2 years because everyone who sees fluid in their legs thinks something's wrong with their heart. I'm going to digress now a little bit because the majority of those people are actually women who I see in my office who come in and they've got primary symptoms because they get swelling their feet at night after a long day of being on their feet, or after a couple of years of working on a factory line or in the store or in the hospital, nurses. And the reason is not because something's wrong with your heart or necessarily because of excessive salt intake. The problem is because the veins in your legs have valves, and those valves become leaky at some point, especially if you've had a kid, if you've had a family history of leaky valves in the legs. And so what happens, rather than blood going back up and not coming back down, those valves are leaky and they stay open, so blood comes back down and stays. And so you have to wear compression stockings to get rid of that fluid buildup in the legs. There are 40 million people who have that term called venous insufficiency. The vein is leaky, so we call that venous insufficiency. But only 1.8 million are treated. So there are about 30-something million people who have swelling in their feet or cramps or burning or skin changes that think that something's wrong with this, either the circulation or something's wrong with their heart that's causing fluid buildup. But the number one reason is because of that leaky vein. And there are different ways to treat it. It's an office visit with a specialist who knows what he or she's doing. So that's the most underdiagnosed condition actually in the country right now. And in the Delta, for every 5 patients they send to me for leg swelling, 3 of them have leaky veins. So now going back to other reasons, from heart reasons that cause swelling, people who have high blood pressure can develop swelling in their extremities because it's just a high pressure system that your body gets overwhelmed and water pulls to the legs. There are people who have weak hearts that have swelling in their legs. There are people who have normal heart function, especially anyone over the age of 65. The problem is not how well your heart squeezes. The problem is the calcium develops on the heart vessels and also in all the major vessels in your legs as we get older or seasoned. So as you get seasoned, you cannot relax your blood vessels as easy as you used to. And if you can't, it pulls blood in your extremities, and that develops a manifesting swelling. Some of the medications we give you to treat some of your blood pressure can cause swelling in your legs. Has anyone heard of amlodipine or Norvasc? Yeah, some people are on it, right? Yeah, it's a great drug, don't get me wrong, it works, but that too can cause swelling in your legs. So, and then obviously, other common ones are leaky valves, people with vessels, that can cause swelling. But in the totality, someone has to understand basically what's going on with the patient, and they've had to done studies to rule in or rule out potential causes for swelling in the legs.
Does cramps have anything to do with that?
Cramps, good. Cramps are the number one reason for number one symptom for peripheral arterial disease in women. Men, we come with pain. And so same thing with heart disease. So when a man is having a heart attack, they don't hide it. They come in clutching and crying and and EKG is abnormal, and we take them to the lab. And same thing with their legs. When they have poor circulation, they come to you and say, "Hey doc, when I walk down 500 feet, I have to stop because my leg hurts." Now women are different. Women will come with some burning in my chest, or it just doesn't feel right, or something. It's not pain, but it's heavy. And then same thing in their legs. They could talk about cramps, a lot of cramps. But before I say everything is poor circulation, your electrolytes, magnesium levels, potassium levels, if they're at normal, they can cause cramps. If you have had a low iron level for a long time, oxygen comes with the blood circulation that's going through. So if you have low iron levels, oxygen is not well circulated in your body, and so you develop cramps. Smokers have cramps because carbon monoxide in tobacco decreases the oxygen circulation in all your extremities, and that's why tobacco smoking is bad, because those cramps can then develop and lead to specific damages, and they're toxic to the muscles of not only the heart but all your extremities, and can cause severe outcomes. So cramps is it's something serious when a patient presents with it, but you have to put in context what's going on with the patient, what medicines, electrolyte abnormalities are there, and if there are any circulatory issues that are going on as well.
Well, before we leave that question,
Yes, sir.
The reason I asked that is because we have a couple of people here that go through those, we call them cramps. I want you to explain if that is really a cramp.
Like arthritis. Now, the question also too, there are people who have cramps, but their doctors have told them it's arthritis, right? I always tell people that whenever you're told it's arthritis, let me just give this stat because you understand how severe this is. 1 in 20 people over the age of 50 will develop peripheral arterial disease, all right? 30% of all patients with peripheral arterial disease, if it goes undiagnosed, the mortality rate, meaning the death rate in 5 years, is about 30%. If you have a wound, that death rate is going up to 50%. A little comparison, 50%, combined breast cancer, colon cancer, and pancreatic cancer, combined, your mortality rate in those 5 years is 50%. So we're talking about, I call peripheral arterial disease something that's similar to cancer. People are more scared of the C word, cancer, than they are of peripheral arterial disease. However, the mortality from peripheral arterial disease is actually as high as 3 cancers combined. So I'm very passionate about this topic because the number one amputation rate in the country is here in the Mississippi Delta. Number one state is Mississippi, and the lowest number of physicians to prevent amputations is also here. So this is my calling, to bring light to this and to enlighten people so as to know that if you're told it's arthritis, ask your doctor, well, can we just make sure the circulation is all right? Do an ultrasound of your legs.
Say that again, please.
Yeah, sure. If you're told you have arthritis or it's old age in terms of circulation problems or cramping or leg pain, just make sure that you get an arterial ultrasound, meaning arterial Doppler, or tell your doctor, can you just make sure the plumbing to the legs are okay? Because